Hello, my name is Andrew Loveitt. I'm one of the surgeons here at Cuyuna Regional Medical Center, and I'm also the director for the Robotics and Hernia program. I'd like to talk to you a little bit about hernias, how they're diagnosed, and how they're repaired. Cuyuna Regional Medical Center has recently been recognized as a Center of Excellence in Robotic Surgery, and for many years we've been recognized for excellence in general surgery. What is a hernia? A hernia is simply a bulge in tissue that occurs over time. The abdominal wall in inguinal or groin region has many areas that have natural weaknesses. These weaknesses can enlarge over time and allow contents from inside your abdomen to begin to protrude through. We also know that these can come from incisions or old surgical scars that have developed weaknesses. How common are hernias? Hernias are extremely common. About 5 million are diagnosed every year in the United States. The majority of these are either ventral or abdominal wall hernias and also inguinal hernias or groin hernias. There's many risk factors for hernias. The most common ones that we look at are sex, more common in males, race, more common in Caucasians, and people that have already had hernias are much more common to have a second hernia. We also know that people that have increased abdominal pressure over time from things like obesity or weakened tissue from things like smoking are more prone to developing hernias. How do I know if I have a hernia? Well, as I mentioned, a hernia is bulging of the skin. This typically comes from intra-abdominal contents protruding through a defect. Patients will most commonly note that new bulge or an enlarging bulge that's developed over time. Often this can be pushed back in and is relatively painless, but sometimes this can be painful and lead to nagging symptoms throughout the day. Ultimately though, the best way to have a hernia diagnosed is by visiting your physician and having a physical exam. This often will lead to the answer right there. Sometimes a CAT scan is required to have more advanced imaging and allow us to truly determine whether a hernia is present. What are the risks to a hernia? Hernias typically don't present any immediate emergency risk. Usually symptoms will develop over time and become gradually worsening until it affects the daily life and a patient desires repair. There are sometimes emergencies that can occur, however. The intra-abdominal contents contain your small bowel, and sometimes that small bowel can get trapped in the hernia and twisted such that it can cause exquisite pain in a real surgical emergency. If you have a hernia and it ever becomes hot, bulging, painful, and drastically changed from its previous state, then I'd recommend that you go to the emergency department immediately or otherwise seek care. What treatment options are there for hernia? Well, unfortunately, there's no exercise or physical therapy that will cure a hernia. A hernia is a defect in the abdominal wall that really requires surgical repair. The question becomes when and how. As I mentioned, hernias aren't truly emergencies most of the time, and so it can be a nice planned out elective operation, which we can discuss with you in detail. There's two main techniques. One would be traditional open techniques through a large scar, and the other would be more advanced, minimally invasive techniques using either laparoscopic or robotic surgery. This is when we use multiple small incisions that heal rapidly and you can recover from more quickly to repair the hernia. What are the benefits of robotic-assisted surgery? Robotic-assisted surgery has benefits for both the patient and the surgeon. The surgeon is able to operate in a minimally invasive means but do essentially what would have once been only possible through a large open incision. We're able to work with instruments that articulate and work much the way a human hand would on the inside of your body. We're also able to see in a 3D magnified view that allows us to see in extreme detail and precision. This typically results in a more rapid recovery for the patient because we're able to do things that we simply couldn't do before. Furthermore, there's been some studies on robotic-assisted repair. One of our goals is to make sure that our patients recover quickly from things that are relatively straightforward procedures, such as an inguinal hernia repair. You can see on this slide here that the gray images are open repair, and the lighter blue are minimally invasive repairs, specifically robotic repairs in the very light blue. In all the parameters in the study, we found that the minimally invasive repairs are much better for the patients. Further effects of robotic surgery are that we can reduce opioid usage. We found within our center that after an inguinal hernia, and often a ventral or abdominal wall hernia repair, people don't require opioids at all. This is in stark contrast to previous large open incisions where people might be on opioids for a week or two, or sometimes even more. This, of course, is very important in our day and age, where we do know that opioids are addictive, and that the longer you're on them, the higher the chance of that addiction is. Can complications occur from hernia surgery? Any surgery carries inherent risks, and hernia surgery is no different. Complications can and sometimes do occur, but they're generally relatively minor. Anytime we make an incision on the skin, there is a chance for bleeding or infection, and that's very, very rare. Other risks that come with hernia repair are inherent to the procedure because we are dissecting around critical structures. Unfortunately, those structures could possibly be damaged. That's extremely rare, and most of our patients go home the same day and never look back. So how are these surgeries performed? Well, it's important to consider that you'll have a preoperative visit with your surgeon, and they'll go over this all in detail with you. It's really important to select the right repair for the right patient. In general, though, at our center, we do focus on minimally invasive repairs, often robotic. What will happen on the day of surgery is that you'll meet with our preoperative team. They'll bring you into the operating room, put you to sleep with a breathing tube in, and then we'll get to work. We make multiple small incisions on the abdominal wall, insert trocars, which subsequently we can insert our instruments through, and then we can go forward with the procedure. The procedure will, of course, vary depending on the hernia, but in general, we try to work within the different tissue planes of the abdominal wall, ultimately close the hernia, and then place a piece of mesh to reinforce. These are a few pictures of hernia repair. You can see on the left is the robotic system. You see the instruments going through very small incisions. And then on the right is an internal view of what we're looking at. It's difficult to explain entirely, but we can talk about this more in the clinic. But essentially what you see is a hernia sac, which is ultimately reduced. And then again, we've reinforced that with a piece of mesh. On the left in this photo is the completed dissection of an inguinal hernia. Again, you can see that there are multiple very important structures that run in that area, but with the precision of the robot, we're able to successfully avoid those. Once we have that completed, we place a piece of mesh over the hernia defect, and then we close everything up and you go home. Again, we do focus on minimally invasive repair at our center. On the left, you see here the stars for robotic inguinal hernia repair of both sides of the groin. This can be contrasted to the images on the right, where there's a large scar on both sides of this patient's abdomen required for the two-sided repair. One can imagine the recovery from the one on the right is a little bit longer and a little bit more painful. What can I expect after surgery? Well, after surgery, we monitor you in our recovery unit for about 1 to 2 hours. At that point, as long as you're doing well and your pain is controlled, we'll send you home. Sometimes for the bigger ventral hernias or abdominal wall hernias, we do keep you overnight just for monitoring purposes. Once you're at home, the restrictions will vary a little bit by the size of your hernia, but what I tell patients is that you use pain as your guide. If you rate your pain on a 0 to 10 scale and your pain is a 2, if you're doing something that's bringing it up to a 4 or a 5, that's probably doing a little bit too much. Most patients can understand this and have a very smooth recovery. It's very normal to be sore afterwards, but you shouldn't have much sharp or shooting pain. Most patients use Tylenol and ibuprofen, and that's more than enough for their pain control. Sometimes you'll need a stronger pill to help you get off to sleep the first couple nights, but that's relatively rare. Depending on the size and location of your hernia, there may be some restrictions on lifting. We do this because lifting increases the pressure inside the abdomen. This usually only lasts for 1 to 2 weeks, but again, your surgeon will counsel you on this beforehand. So why choose CRMC? Well, as we mentioned before, we're highly recognized for both robotic and general surgery. We've been performing minimally invasive surgery for over 30 years, and we have a team of surgeons and staff that is dedicated to that. You see all of our partners here, Dr. Lemire, myself, Dr. McAllister, Dr. Roberts, and Dr. Severson. We're all accomplished minimally invasive and robotic surgeons and do these repairs day in and day out with highly successful patients. I appreciate you all taking the time to watch this. I hope you learned something about hernias and we can help you in the future. If you have any questions, please do not hesitate to call. We're always happy to talk to patients in any way, shape, or form, whether it be telephone, video visit, or in the clinic.